designed to help you.
It was designed to help those people that, didn't telework,
Right.
that,
Yeah. But that's out
were
the door because we're just
negatively
doing the all rise
impacted.
now.
So,
7:48. Let's head into the KUM News Zoom room where we have joining us Dr. Hoa Wen of the Physicians Advisory Group. Good morning, Doc.
Hi, Doc.
Unmute.
Okay.
There
Good
you go.
morning.
Right. Good morning.
New phone.
Yeah. New phone. Who this?
My phone crashed. I don't know what happened.
Well, thanks for joining us, Doc. We got to ask, you came on here Friday morning. You said we're spiraling out of control. I want to ask the governor to immediately implement restrictions. We were waiting. We didn't hear anything. There was a big gala over the weekend. You advised people to stay home this weekend. No, nothing came out of the governor's office. Nothing came out of public health. So what's the latest situation?
Yeah, I think there's a Make-A-Wish Foundation gathered this weekend, but that is a very unique first on Guam is that they require to give proof of vaccination in order to attend or have a PCR testing done to show you negative, 72 hours before you can attend the gala. So they really take a lot of precaution on make sure that their event is safe. So we really appreciate what they do. Like I say, they set the standard for Guam on the event to come. I think that's the only way you can make it safe and know that the risks of any transmission during a type of event that have large number of people get together, that you won't have a breakout or a cluster coming out of that one. So we'd like to say thank you for them for doing that. Regarding the restriction, I said we make the recommendation and the governor have to do that. I know that she's planning to put something together. It's just the question is when. We are waiting for the JIT to release to see what the testing on Friday and Saturday, what's the number count coming out. I know public health have a change the shift on the way they test it. They do the testing on the GN ground there. So I wonder, see how much that can they run the PCR every day. So we wait. Like I say, the JIG report should come out today and see what the total positive would have in the last 2-3 days or so. But again, the Delta virus is here, the variants, and we don't want to be. We see what happened in Hawaii. You can see there's a huge number in Hawaii. We can see a huge number in the state, and we just need to be proactive and not wait until it happens, because our healthcare system here in the island is not as robust as Hawaii nor the state. I know that both GMH and GRMC are pretty much maxed out on their capacity on admission. That's including COVID and non-COVID patients. Right now, both of them are completely full in the hospital. I know over the capacity at this point. So any COVID patient that get admitted create a humongous burden to both hospitals. Once you get admitted, ICU or not ICU, it's the same thing. So we should concentrate on the number of admission for COVID rather than ICU admission alone.
I'm sorry, how many are you aware are hospitalized?
I think it's over 10 still. Again, we set the limits for the threshold at 10. In the past, when we get to 10 COVID admission in the hospital, that we need to place some restriction. So we would pass 10 already.
Doc, so I mean, you met with the governor Friday. You said you're meeting with her this morning. When you met with her Friday and you pled your case, what was the response you got?
You know, I think everyone is very much concerned on the double digit positive in the community, and like I said, we asked to have some restriction. Some certain restriction are pretty much unique now, on especially on the vaccination status. That one, I think public health will have to put into some type of language before they can put it out. But again, what we're asking for is publicly to limit the number of gathering in one place. I think that's where the current cluster are identified. So we just need to make sure that we do not have a unlimited number of gathering at this point. I think that's still very dangerous when you know that the Delta variants are here. You know, our percentage of vaccination on the island is almost the same as Hawaii. You know, they're a little bit below us, but they're not far behind us. But you can see that once it takes a grip on your community, is very dangerous. So again, we just learn from other people on what happened to them, and we need to do preventive stuff and try to not be in the same situation as Hawaii or the state at this point.
You mentioned a limit on social gatherings, but you also mentioned with regards to the Make-A-Wish Foundation gala that they had over the weekend. What if, should there be a limit on social gatherings if you do require vaccinations and you do require negative PCR tests?
Yeah, I think at this point, we just want to see how the mitigation step that they took this weekend to see if anything come out of it. You know, the vaccination status is very new step to try to decrease any type of cluster. You can see in the state picking up very much the same way. And so we just want to see in the next few weeks to see if anything come out of any cluster coming out of an event that they have some such a like to ask the requirement for vaccination status. So that's what we're going to try to do. I just have a letter from my daughter's school in New Orleans. New Orleans, as big a city they are now implemented any restaurant, gym, event, anywhere public that you attend, you have to provide the proof of vaccination before you can enter. Even the New Orleans Saint and the Superdome, if you don't have the status for vaccination, you cannot come in. So that's something that just because of Delta, pretty much get a grip on the people in the state, and so much admission to ICU. And so we just want to do things that we don't want to get where they are. And again, we just ask our people to be very, don't let your guard down, especially the people that fully vaccinated. You still need to wear your mask, and you need to make sure that during gathering that you can minimize any contact. Just again, with the Delta variants, the fully vaccinated can also contract the virus, and they can transmit the virus. The only difference with the vaccinated and unvaccinated is that the severity of the symptom are much, much less on the fully vaccinated, and the chance of being in the hospital much, much less. So that's the only difference. So right now, just be cautious and wear your mask and social distance, wash your hand. That's the best way that our community can defeat and keep the Delta variants at bay. And also, if you're not vaccinated, go get yourself vaccinated. Because again, we are fully expected Pfizer to be fully FDA approved by the first week or two of September.
Doc, can you
Yeah,
be?
that's just Pfizer though.
Yeah.
There's still 2 other vaccines.
Yeah.
Yeah,
Doc-
I think usually Pfizer, set the bar, and then Moderna right behind it.
Mhm.
So we fully expect them to be fully approved by FDA. And I think after if they get approved by FDA, we will expect to see quite a few more people will get themselves vaccinated. But that's all they're waiting for.
It's 8 o'clock. Oh, we're not going to
Yeah,
go on
right.
TV. That's okay. So Doc, can you be more specific with the recommendations that you presented to the governor, or the PAG represented to the governor?
Yeah, we asked to have some limitation on the gathering. The number be set by the governor. We asked them to look at ways to implement the check on the vaccination status on business, especially restaurant, that you can dine in if you are fully vaccinated, and you can prove that. If not, then I asked the restaurant to have some dining out outside for people that is not vaccinated. The minor are as below 12 exception, just because they cannot get themselves vaccinated. But things like that, we need to start implemented. But again, the language and the enforcement of that is something that public health have to put in writing before they can start it. And just like New York, they give business on 2 or 3 weeks lead time to implement the program. If they can do that in a city of millions, I think on island it's not going to be that hard to do.
So what are you guys going to talk about today? You have a meeting with the gov?
We just
Same thing?
review what's going on in the past few days and try to make necessary step to kind of curb the surge at this point. We do our, if we're not careful, this is our number 3. This is a third surge that we have. If we're not careful.
So it sounds like you're stopping short of calling it a surge. Is it a surge, or it's not a surge?
I think the number of double-digit positive we have in the past 2 weeks or so, like I say, for everyone that positive out there, I'm sure that there's more positive that have not been tested.
So yes, it's a surge.
Yeah, I mean that's reality, right? I mean, some of the fully vaccinated people are asymptomatic, and so for everyone that come in test positive, there's a few more out there that have not been tested that are positive, but they are in our community, and they're going to spread unless we make some restriction out there to minimize, especially the gathering.
Do you have any, like, numbers when you talk about limiting the gatherings? Are we talking about like at home, or are we talking about like galas and stuff?
The home situation is very hard to control, and I think that the last time that we put a limit on the gathering, our people listen. I tell you, you gotta give credit to the island. We listen. Even at home, a lot of people are restricted what the number of people they invite over their house. So I think we can put the limit of gathering in the public place on the stuff. But again, a lot of people will see the limitation number, and they will follow at home. We always want to have a few people that will defy the order, but if we can implement it, if the majority follow, then the less chance that we're going to have a cluster somewhere.
Doc, I know that we talked to you late last week with the booster. Has there been any development locally?
Yeah, I think right now the only thing that we um looking for is basically for the immunocompromised patients, the cancer patient on chemotherapy, certain autoimmune disease that we're gonna have, some organ transplant, and maybe the dialysis patient also fall into that category to have the third shot. But I think that it should be rolled out. I think it should be rolled out already. They just need to put a plan together and go out there and ask those people that qualify to come into any clinic to get the vaccine, the third dose. And the rest of the general population, we still wait for the FDA to send out their recommendation for the third dose. So I said a lot of things going to happen in September, October timeframe, just because once the FDA fully approved the Pfizer, Moderna, is a lot of things going to happen.
Doc, have you heard anything about vaccinated positives not following quarantine?
That's always a few people that that turn positive, especially fully vaccinated, and as much as we ask them to stay at home and quarantine or isolate, just because with the Delta variant, the fully vaccinated asymptomatic person can have a chance to transmit the virus too. I just ask people to respect each other and stay home and don't go around because you don't want to make other people sick around you. So at this point, like I said, when the Delta variants come on board, it's a totally different game, and we have to remind people to go back to the basic again. We cannot realize that on the vaccine alone, we just have to also realize on the basic stuff. But the vaccine is the key, the really, really key part to keep our hospital down. You have to understand, right? The hospital, the normal day, our hospital pretty much max out the capacity already. But when you put on the COVID, it really stressed the healthcare system a whole lot. So people go out and get yourself vaccinated to just help our island to go forward with the Delta variants.
All right. Thanks, Doc. So the main message this morning when you meet with the governor again is to impose restrictions?
Yeah, I mean, we have to do prevention. We gotta do prevention, and we cannot wait until something happened and then we take steps. We see what happened in our community around us in Hawaii, in the state. We see what happened. We see what come down the line. So we need to do preventive measurement rather than it happened and we start put the fire out. It's not the good thing to do.
Thanks, Doc.
You're
Good
welcome,
luck
guys.
today.
Be
Good
safe.
luck. Don't
Okay?
make her mad. Say please.
Okay.
Okay.
Bye.
Yeah, I see. Sound like she already mad though. There you go. That's Dr. Ho Wen. Boy, wow. I'm still on the all rise thing. We got to get into the news.